Good evening, everybody. My name is Dr. Dennis Goodman. I'm a clinical professor of medicine and cardiology at NYU Langone Health and the Grossman Medical School. We are delighted that you are all joining us tonight. As you know, I'm very proud of our Heart Health Lecture Series. I always say kudos and thank you so much to Anya, who's been incredible in helping me do this. So thank you for joining us. We have an amazing speaker tonight, which I'll introduce shortly. Next slide. So this is very important for you. We're talking about technology, and I think this is one of the things we've all learned to do, which to ask a question on Zoom. And all you need to do during the talk is to write a brief question in the Q&A section. And I will try to get to as many questions as possible. Don't use the chat box, use the Q&A box. And if you'd like, you can put your name and I'll try to get to as many questions as possible. Next slide. So our next lecture is in about 6 weeks. Actually 3-4 weeks, sorry. Don't take your bones for granted. It's all about osteoporosis update. We did osteoporosis once before. It was extremely popular. And I chose that title because so many people don't realize that their bones are getting weak until they have a fracture. So that is going to be a very important lecture all about how you can keep your bones healthy and strong. And that's for men and women. That's May 25th. And there's how you register online. Next slide. So here's all about our Heart Health Lecture Series. There's many ways to connect with us. There's the website. There's the email address. And we're also on Twitter. I think you all have this information. And we do send out, as you know, all the information you need to sign up for these lectures. And once again, thanks to Anya. Next slide. So we've had many past topics. We've had about 60 or 70 talks over the past several years. And as you know, they all focus on prevention. I say many, many times that prevention is so important. How do you prevent heart attacks and strokes? And how do you prevent chronic illnesses? That's what this is all about. And so I always pick topics that are related to prevention and what you can do about it. And you've heard me say, wellness is not the absence of disease. You've got to work hard. You've got to be proactive to keep yourself healthy. And that means preventing the first or second heart attack or stroke. And I have an absolute expert tonight in this field, and I'll introduce him shortly. Next slide. So Dr. Gordon, who is a colleague of mine, and a wonderful friend. Excuse me for 1 second. I just want to pull this up. Dr. Gordon is the co-founder and CEO of Intervent International. Intervent is a technology-driven behavioral management population company, and he's very much focused, and he spent his whole career and life thinking about how we prevent illness and disease, especially in the cardiovascular space. He obtained his medical degree and PhD in exercise physiology from the University of the Witwatersrand in Johannesburg, South Africa. As many of you know, I'm also South African, so he is a Landsman. I went to the University of Cape Town, and I think we'll both agree that we went to terrific medical schools. He relocated to the United States in 1987 and obtained a master's degree in public health from UCLA. He's a fellow of the American College of Cardiology and board certified in public health and general preventive medicine. He's authored over 120 published scientific manuscripts, 8 books, and numerous scientific abstracts on the topic of chronic disease prevention and management. He's also served as an associate editor of the American College of Sports Medicine, Guidelines for Exercise Testing and Prescription, the world's most widely read academic text on the topic of exercise science. Dr. Gordon is a former chairman of the American Heart Association's National Committee on Exercise, Cardiac Rehabilitation and Prevention. He's a current faculty appointment, has a current faculty appointment as a visiting professor at the University of the Witwatersrand. Dr. Gordon, Neil, thank you so much for joining us. I'm so grateful that you agreed to talk to my audience. They are a terrific audience. We have a real following, and we are delighted to have you join our esteemed faculty. And just before you start, let me tell people the topic is preventing a heart attack and stroke. Your smartphone can help. And really what we're talking about is the use of technology in modern times to help in preventative medicine.
Great. Well, thank you very much, Dr. Goodman, and thank you, Anya, for all of your assistance. It's an absolute pleasure for me to talk to you tonight on the topic of preventing a heart attack and stroke. Your smartphone can help. I've decided to divide tonight's presentation into a number of different sections. First, I will start off by briefly discussing some of the challenges that face us in the field of cardiovascular disease prevention and risk reduction. Second, I will briefly review some of the important risk factors for cardiovascular disease and discuss what is known as the cardiovascular disease causal chain. Third, I will review some of the key steps we all should be taking in order to reduce our personal risk. I will then shift gears and fourthly discuss harnessing mobile health technology to facilitate cardiovascular disease prevention and management, and end off by sharing some sample results from innovative interventions before we go to the question and answer section. With that in mind, if we stop and think about it for a few moments, we've all been extremely fortunate in that we've seen some pretty amazing technological advances in the field of cardiovascular medicine during our lifetimes. Coming from South Africa, the one that always stands out in my mind is the first heart transplant that was performed in Cape Town, South Africa, where Dr. Goodman went to medical school, as he mentioned. It was performed by Dr. Chris Barnard back in 1968. Unfortunately, though, despite all of those impressive medical and technological advances, chronic diseases, in particular cardiovascular disease, remain by far the leading cause of premature death, disability, and rapidly escalating healthcare costs. What's even more unfortunate is that on the basis of recent deleterious or negative risk factor trends, such as the alarming increase in the prevalence of overweight and obesity and related conditions like type 2 diabetes, it doesn't appear that the situation is going to improve significantly in the near future. In fact, there is some evidence that we may be headed to a worsening of the situation. And that was before COVID-19. We've all focused an immense amount of attention on the COVID-19 pandemic, and rightfully so. But many people have forgotten that there is this other pandemic that's underway at the same time, the chronic disease and cardiovascular disease pandemic. And unfortunately, what's happened is the two pandemics are now interacting to create what I like to refer to as a perfect storm, in which each is contributing to the worsening of the other. Very early on, during the COVID-19 pandemic, we came to realize that many of the adverse consequences of COVID-19 were actually being driven by the interaction between a virus, the SARS-CoV-2 virus, and an unwell or unhealthy population, a population that for the large part leads unhealthy lifestyles and has a high prevalence of cardiovascular and other chronic diseases. And as the slide points out, showing some data from the CDC, hospitalizations were actually 6 times higher and deaths 12 times higher for COVID-19 patients with reported underlying chronic conditions, the most prevalent and most important being cardiovascular disease, diabetes, and then chronic lung disease. So as we head into the era of COVID-19 and beyond, we're going to see even more importance being placed on cardiovascular disease prevention and risk reduction, and this is going to become known as an essential service. The good news is that many chronic diseases, including cardiovascular disease, are to a large degree lifestyle related and therefore potentially avoidable. In 2002, a well-known researcher, Dr. Walter Willett, published a paper in the journal Science in which he estimated the percentage of cardiovascular disease that is potentially preventable via lifestyle intervention. And he found that among US adults, more than 90% of type 2 diabetes, 80% of heart disease, 70% of stroke, and even 70% of certain cancers like colon cancer are potentially preventable by a combination of not smoking, avoidance of overweight, participation in moderate physical activity, eating a healthy diet, and either not drinking alcohol or drinking only in moderation. So that's the good news. With that in mind, let's delve a little bit deeper into some of the cardiovascular disease risk factors and also discuss what is known as the cardiovascular disease causal chain. Before I do so, though, there's an important question that I'm often asked that I'd like to try and answer. And I'm often asked, well, what about if I have a family history of heart disease or stroke? What about genetics? And I'm going to answer that by telling you a quick story about some of the lessons that I've learned through working with world-class athletes. Over the years, I've had the privilege of working not only with many patients with cardiovascular disease, but also healthy people, some of whom were athletes, some of whom were world-class athletes. As an example, I helped the tennis great Jimmy Connors with his diet and his exercise training program when he made his big comeback at the age of 39 and made it to the semifinals at the US Open. And we actually wrote a book together called Don't Count Yourself Out, Staying Fit After 35. In those days, we used to think that 35 was pretty old, and now it seems really young. But for those of you with really good vision, you can see my name featured prominently on the front cover of the book. But I tell this story because one of the things that I learned from Jimmy and other athletes is that they have immense genetic potential and capabilities. But at the same time, they also put in a lot of hard work. And without all of that hard work, nobody would have heard of Jimmy or, for that matter, any of the athletes that I've worked with throughout my career. When it comes to heart disease and stroke, I like to think of it like a gun. Our genetics loads the gun, but it's our lifestyle and our environment that pulls the trigger, and unfortunately, often with devastating consequences. The bottom line is that your genes are not your destiny, and we're going to talk about some of the things that can be done today to prevent heart attacks or strokes, or prevent your situation from worsening if you've already developed a problem. But even if you have a strong family history of heart disease or stroke, what I'll be telling you about is equally applicable, if not even more applicable. As far as the cardiovascular disease causal chain is concerned, as we can see in this slide, we have what are known as behavioral risk factors. These include cigarette smoking, physical inactivity, incorrect nutrition, excessive stress. We could add also excessive alcohol consumption to the list. The behavioral risk factors contribute to a worsening of what are known as physiological risk factors, including our body mass index, which is an indicator of overweight and obesity, blood pressure, cholesterol values, and blood glucose. In turn, the behavioral risk factors and the physiological risk factors result in the development and worsening of chronic diseases, including heart disease, stroke, type 2 diabetes, cancer, and respiratory diseases. All of these factors then combine to increase the risk for COVID-19, something we've got to be aware of during the pandemic, and predisposed to a greater severity and poorer outcomes. So really the key is to break this causal chain at every link along the way. How do we do that? I'd like to tell you about one of the landmark studies in this field that I think drives home the best approach for cardiovascular disease risk reduction. This is a study that was conducted by researchers at Stanford University. The main paper was published in the journal Circulation in 1994. The study was entitled the Stanford Coronary Risk Intervention Project, or SCRIP. In the study, there were 300 men and women with coronary artery disease. They were randomly assigned either to usual care, which was a very high standard of care at Stanford, or to a special program that focused on the modification of multiple coronary artery disease risk factors through the combination of comprehensive lifestyle changes and appropriate drug therapy, for example, medications where needed to control blood pressure and high cholesterol values and elevated blood glucose values. In the 4-year study, they found that the multi-factor intervention slowed down the buildup of blockages inside the coronary arteries by a staggering 47% compared to usual care, and also reduced hospitalizations for cardiac events by 39%. So this was one of the initial landmark studies to emphasize the importance of the modification of multiple risk factors through a combination of comprehensive lifestyle changes plus the appropriate use of cardioprotective medications. With that in mind, let's now, from a very high level perspective, talk about some of the key steps that you can take, and for that matter, all of us can take to reduce our personal risk. We have to make our health a priority. One of the key factors is eating a healthy diet. It's important to eat what is referred to as a healthy dietary pattern. And that's a diet that includes fruits, vegetables, whole grains, beans, legumes, nuts, seeds, olive oil, and except if you're on a whole foods plant-based diet, also lean meat, poultry and fish, and fat-free or low-fat dairy foods for balance and variety. We should be choosing foods that are rich in vitamins, minerals, fiber, and healthy fats. At the same time, where possible, we should avoid foods that are processed and foods with saturated fat, added sugar, and sodium. We should be drinking water or beverages without added sugar. And if we're going to drink alcohol, it should only be in moderation. It's important to take charge of your lifestyle, and another key factor is participating in regular physical activity. Each of these are presentations in and of themselves, so I'm just hitting some of the high points. But from a cardiovascular disease prevention and management standpoint, the basic recommendation is to get at least 150 minutes per week of moderate to vigorous intensity aerobic exercise, such as brisk walking. You don't have to do it all at once, and you should build up gradually if you're currently sedentary. It's important to add physical activity to your lifestyle where possible. So take the stairs instead of the escalator or the elevator, work in the garden, do housework, play with the children or grandchildren. And from a balanced fitness perspective, we should also add resistance training and stretching exercises to our program. It's important to think positively. We know that an elevated body mass index, which in many instances is indicative of a person being overweight or obese, is an important risk factor. We should be aiming for a BMI of less than 25, ideally. But the good news is that the research shows that if you're overweight or obese, even losing somewhere between 5 and 7% of your weight can have profound benefits from a health perspective. So if you're able to lose 5% of your current weight, you will markedly benefit your health and reduce your risk for cardiovascular disease, type 2 diabetes, and many other chronic illnesses. It's important, though, to relax and recharge, to practice stress management, set time aside for yourself every day. Now, today we're talking about the benefits of cell phones, but there are certain times where it's really good for you to turn off electronic devices in this modern day and age and practice deep breathing, visualization, meditation, yoga, or another stress management technique that you enjoy. Research also shows that staying connected to others is beneficial. That's obviously been a challenge for the past year or so as a result of COVID-19. A couple of other items of importance when it comes to staying healthy is don't smoke cigarettes. If you do, it's important to quit. Ideally, you should not vape and you should not use smokeless tobacco. It's critically important to get appropriate preventive care, to work with your healthcare providers. Everybody should know their lab values. For example, you need to know your blood pressure, your cholesterol and triglycerides, your glucose and A1C, body mass index. Know what your values are, and where appropriate, also know what the goals or targets are, and ensure that you work with your healthcare provider so that your values are all at the target level, and where needed, you're on appropriate medications. You should talk with your healthcare provider about the various preventive exams, screenings, tests, and immunizations that are recommended for your age, gender, and health status. And again, I cannot emphasize it enough, although a major focus of what we're talking about today is lifestyle, where appropriate cardioprotective medications are extremely important, and you need to take your medications as prescribed by your healthcare provider and cardiologist where appropriate. Finally, believe in yourself, set yourself small goals and work towards those goals. You don't have to do everything all at once. Take it one step at a time and gradually work towards your goals. Let's now shift gears and talk about how we can harness mobile health technology to accomplish some of what I have been talking about from a cardiovascular disease prevention and management perspective. Dr. Goodman mentioned in his introduction that it's hard work to lead a healthy lifestyle and do everything that we need to do to reduce our risk, and he's 100% correct. I like to say that we live in a toxic environment, and by a toxic environment, I don't necessarily just mean the air that we breathe. I mean the fact that we've engineered physical activity out of our lifestyles. We've made it far harder for people to lead a healthy lifestyle, to be physically active. Many of us sit behind desks the whole day, and that's been worsened by the COVID-19 pandemic. We turn on our television sets, we see ads for foods, and often it's foods that are processed and very high in saturated fat, added sugars, and refined carbohydrates. And the problem is that they're often inexpensive and taste really good. So it's become challenging to lead a healthy lifestyle. He's saying, I'm willing to make some changes in my lifestyle as long as I don't have to do anything different. Now, unfortunately, we do have to do something different, but the objectives that we set can be accomplished if adopting the right approach. And hopefully by the end of today's presentation, you'll understand how digital health and mobile health technologies can benefit us. There was a survey conducted by an institute called IQVIA in September 2017. They looked at a variety of different digital health and mobile health approaches, ranging from text messaging to health system disease management apps, consumer mobile apps, wearables such as activity trackers, sensors and devices like blood glucose monitors and blood pressure monitors, I'm just going through this quite quickly: telemedicine and virtual physician visits, leveraging personal health records and various web-based interactive programs. Interestingly, as part of their initiative and as part of the survey they conducted, they found that in 2017, there were over 318,000 health apps worldwide, and more than 200 new health apps were being introduced via Apple Store and Google Play per day on average, which makes it impossible for us to keep up with all of the various apps. And this is one of the reasons why another take-home message is important to work with your healthcare provider, work with your healthcare system, because they'll often be able to guide you towards resources that they may be making available, or tell you which are some of the more credible resources to utilize. I'd like to quickly run through some findings from other surveys which are more recent. We'll start off with a survey, the 2020 Digital Health Consumer Survey, conducted by a consulting company called Accenture. One of the questions that they asked was, which of the following technology or electronic health management tools have you used to manage your health in the past year? And it was quite interesting that when it came to the use of mobile phones and tablet applications, there was an increase in utilization from 2014 to 2018, but from 2018 to 2020, and this was just before the pandemic hit, there was actually a decline in utilization when they looked at wearable technologies such as activity trackers, etc. They found the same, that there was an increase and then a decrease from 2018 to 2020. They asked another question then. The question was, what might keep you from using various digital devices for your health questions and care? Again, the data was really interesting. 41% of individuals said it was concerns about my privacy or data security. 22% don't trust the effectiveness of the service. 16% prefer my current providers. So those are some pretty interesting findings. They then ask questions about, think about the digital tools and services that you previously noted, and how beneficial were these to you? How much did you benefit from them? Interestingly, 43% indicated that the tools were beneficial in that they increased focus on wellness and prevention. 34% said it had given them a better understanding of their health, and 24% indicated that a major benefit was increased convenience of and accessing care. This next slide is a somewhat complicated slide, so don't worry, I'm not going to go through it in detail, but this is an even more recent survey conducted by another consulting company, Deloitte. This was conducted in April, May 2020, just as the pandemic was taking hold of our lives. And it's very interesting in that when they looked at scenarios where consumers would be willing to share data from fitness and health monitoring devices, on a positive note, the percentage increased from 53% up to 60%. And when it came to sharing personal health information as a result of the crisis, the percentage also went up. In my opinion, one of the pluses of COVID-19 is the greater acceptance of telemedicine, digital health, and leveraging mobile health to benefit our health and wellness. This is a final survey conducted in September of last year, where they were able to show that the use of health apps had increased by 37% during the survey. Most recently, this month in April 2021, the American Heart Association published a scientific statement entitled Harnessing Mobile Health Technology for Secondary Cardiovascular Disease Prevention in Older Adults. And I'd like to quickly review with you some of their observations. For their study, for their paper, 26 studies that utilized mHealth for the secondary prevention of heart disease and stroke, that focused on lifestyle behavior change and medication adherence in individuals with a mean age of 60 or greater were identified. And these are some of the findings and conclusions. Improvements in health behaviors and medication adherence were observed, particularly when there was a text messaging component involved. In studies with app-only interventions, the majority of patients did report ease of use. Patients found the app helpful, and self-reported use of the app was high. However, many of the apps that were tested were intended for a very specific purpose. And as we'll discuss in a few minutes, really one of the keys is to utilize apps and other technology as part of a comprehensive intervention. Although mobile technologies are becoming more mainstream and are starting to blend more seamlessly with standard healthcare, there are still distinct barriers that limit implementation, including affordability, usability, and as we've already discussed, privacy and security issues. They indicated that future studies are needed. And as our population ages, identifying and implementing effective, widely accepted, cost-effective, and time-efficient mHealth interventions to improve cardiovascular health should be a top health priority. I won't go through this slide, but what they did is they emphasized the importance of using such technology in conjunction with your regular care and integrated with the care provided by your doctor and other healthcare providers. This is also a complicated slide. In 2019, my colleagues and I published a chapter in a book entitled Lifestyle Medicine. Our book chapter was entitled Using Digital Health Technology to Promote Cardiovascular Disease Risk Reduction in Secondary Prevention. And we emphasized the potential benefits and also spoke about what we thought would be happening in the future, where we'd be leveraging digital health to a greater degree and leveraging it together with what is referred to as precision health or precision medicine, where the intervention is very targeted to the specific individual, in certain cases also leveraging what is known as genomics, and to make such interventions very scalable and cost-effective, leveraging newer technologies such as artificial intelligence and machine learning. And that's what's headed in our direction. This slide provides an overview of the kinds of interventions that are being offered on a limited basis that I believe will become the standard of care and commonplace in medical care. There will be interventions with 4 corner posts, the corner posts being assess and intervene, engage and support, track and monitor, analyze and report. To assess and intervene, from the assessment stage, we'll utilize data from a variety of sources, health assessments, electronic medical records, medical and pharmacy claims data. Interventions will include entirely digital interventions, as well as a live one-on-one personal health coaching, all focused on cardiovascular disease prevention and management and leveraging digital health. In between visits to the patient's doctor or in between coaching sessions, participants will interact with the digital platform. There will be a variety of approaches used to engage individuals, keep them involved in programs, initiatives such as targeted communications, wellness campaigns, challenges, gamification, group webinars, the use of incentives and rewards. We'll all be able to sync various wearables and devices to the participant-facing applications. So you may use a variety of apps, but they'll all be synced to one app, and the data will then be leveraged to help you receive better care, and it will all be utilized for aggregate data reporting and quality assurance purposes. This is a high-level depiction of what I mentioned, where there'll be the one-on-one interactions with professional health coaches, and then the ability to leverage various resources between the coaching sessions. That approach is already being used, as I mentioned, in certain situations. There's a study that we're involved in, funded by the National Institutes of Health, involving over 130 medical centers, called CREST-2. If any of you have blockages in your coronary arteries, you may want to speak to your doctors about this. This is a study that's coordinated through the Mayo Clinic and underway throughout North America, and there are some sites in other countries as well that are participating. The intervention that I mentioned is also being used as an example as part of the Canadian Diabetes Prevention Program, which is a free initiative. If any of you live in Canada, it targets individuals who don't have diabetes but have a condition called pre-diabetes, where you're at risk of developing diabetes in the future. One of our challenges will be evaluating apps. And again, I have to emphasize it's important to speak to our healthcare providers. There are a number of scientific manuscripts that have been published, which have used different approaches to evaluate apps. In this study, they utilized a variety of criteria, the features of the app, various attributes, medical claims that were made and the evidence backing it up, consumer ratings, and function. One website that I have found quite useful is Healthline. You can just Google that, go on and type in best apps of 2020. It will then bring up a host of information for you, for example, on best heart disease apps, fitness and exercise apps, nutrition apps, depression apps, and reminders for your medications. So that is something that's quite useful, but again, discuss it with your provider. Very quickly, a few websites and applications that I found useful. The American College of Cardiology and American Heart Association have an atherosclerotic cardiovascular disease risk estimator. Again, you can Google it. You enter data and it tells you what your future risk is. It also provides you with some basic information on the kinds of things that you should be doing to minimize your risk. Another credible organization is the American Society for Preventive Cardiology, or ASPC. My company has collaborated with ASPC during the COVID-19 pandemic to make a variety of free resources available. They're meant to be for use by patients of doctors who belong to ASPC, but if you go to the ASPC website, this is really available to anybody. Should you be interested, you can sign up, take an intake assessment, receive various risk scores, and receive all free of charge interactive educational content on a variety of topics related to cardiovascular disease. The ASA 24 is often used in research studies, but available to the general public free of charge. Again, you can Google this. You enter information. It takes about 30 minutes, and it provides you with a very comprehensive report on the percentage of calories that are coming from fat, saturated fat, carbohydrates, etc. It gives a nice breakdown of the macronutrient intake. This is a somewhat simpler application that can be used. It's offered by the National Institute for Diabetes and Digestive and Kidney Disease. It allows you to personalize caloric and physical activity plans to reach goal values. For those of you who are interested in a vegetarian diet, another free application and website is one that's offered by PCRM, which is the Physicians Committee for Responsible Medicine. And a number of patients and participants that I've interacted with have found this to be very, very helpful. The USDA has a wealth of information as well on their website about nutrition. This slide is just simply to emphasize that, again, in the future, the use of these apps will be combined with newer technologies and advances such as precision medicine. For the final 5 minutes before we go into the Q&A section, I'd like to very quickly review with you findings from studies that we've been involved in that have evaluated the effect of comprehensive approaches to cardiovascular disease risk reduction that have either utilized a comprehensive lifestyle modification or the combination of comprehensive lifestyle modification coupled with appropriate medication use, and has leveraged as part of an integrated program some of what we are referring to. In 2002, we published a paper in the American Journal of Cardiology in which we compared an approach using health coaches to provide such services to more traditional approaches such as on-site cardiac rehabilitation and care provided exclusively through the doctor's office. We found that the health coaching approach was equally effective, an advantage being that it was more accessible, less expensive. Now, I need to emphasize that the purpose of the study wasn't to say that you shouldn't use cardiac rehabilitation. Cardiac rehabilitation in its traditional form is extremely beneficial. If you can participate in a cardiac rehab program and you haven't, it's one of the first things that you should do. But the good news is that for individuals who are unable to participate in such programs, there are other options. More recently, in February of this year, I collaborated with a group led by clinicians and researchers at Johns Hopkins and involving experts from UCLA and Stanford. We reviewed all of the literature on using digital health for cardiac rehab and concluded that digital technologies have the potential to increase access and participation in cardiac rehab by mitigating some of the challenges associated with traditional facility-based cardiac rehab. And in the era of COVID-19, this has become increasingly important. Back in 2004, we were able to show that just 12 weeks of participation in a comprehensive lifestyle management program without the use of medication, 37% of individuals with type 2 diabetes could actually reverse their diabetes, meaning they could get their blood glucose level down into the normal range. More recently, at last year's American Diabetes Association annual meeting, we published data showing that a comprehensive program could help normalize blood glucose levels within 6 months in about 45% of individuals with pre-diabetes, blood glucose levels above normal, but not high enough for a diagnosis of diabetes. And that occurred irrespective of whether at the start of the program, individuals were normal weight, overweight, or obese. I have 2 more slides and then I will be done and we can move on to the question and answer. I mentioned the CREST-2 clinical trial that's currently underway, funded by the National Institutes of Health. Prior to that study, there was another study focusing on stroke risk reduction in individuals who had already had a stroke or a TIA or mini stroke. As part of this study, an approach was also utilized involving telehealth, where individuals participated in a comprehensive lifestyle management program and also received aggressive management of risk factors using medications. What's quite interesting, there were papers published in some of the world's leading medical journals. This is one of the papers published in the journal Neurology in 2017. What's interesting is that they found that physical activity and intensive control of blood pressure and cholesterol were important for reducing vascular events. This was over almost a 3-year period, and They evaluated vascular death, non-fatal heart attack, non-fatal stroke. But while all three of these factors may contribute to the risk of vascular events, the independent effect of physical activity was stronger for the prediction of vascular events than blood pressure and cholesterol reduction. So the study emphasized the importance of participating in physical activity, and some of the analyses performed indicated that participation in the health coaching program, which was provided using telehealth, played an important role in getting people active and in modifying various risk factors. There was an accompanying editorial that was written by two world-renowned neurologists. And to conclude my presentation, I'd like to read you what they concluded in their editorial. They said that regular weekly exercise can lead to a reduction in serious events such as recurrent stroke, heart attack, and vascular death. So for both patients and clinicians, what are you waiting for? Reaching for your exercise shoes may be as important as reaching for your medications. And it's my belief that in the very near future, we'll add to this that reaching for your cell phone and some of the digital technologies can also be extremely important. And with that, I'd like to conclude my part of the presentation. Thank you for your attention. It's greatly appreciated. And I believe we're now going to move on to questions and answers. Thank you.
Dr. Gordon, that was terrific. Thank you very much. You did a beautiful job in a short time, just really proving the point, which is prevention is absolutely essential. It's been stated, and I'm sure you'll agree, that 80% of heart attacks and strokes are preventable. The thing that I ponder all the time is that most people don't pay attention to the things that you've spoken about today. And sometimes we really are talking to the converted. And so one of the questions I have for you is, how do we get the message across now that we have, social media and a way to connect with people where you actually don't have to walk into the doctor's office? Do you think that it's making a difference in connecting with people who are at high risk, but they never ever seek medical attention? They don't realize how high risk they are. And they only get highly motivated when, unfortunately, something bad happens to themselves or someone in the family or a close friend. Are we making progress with a large, I'd say the majority of people who aren't listening to your lecture or anything that we have to say until there's a real problem?
Dr. Goodman, that's an excellent question. If you look at the statistics that are available, it's really very disconcerting. There's a survey that you're very familiar with called NHANES, and when they evaluated the data, it's a National Health and Nutrition Examination Survey, they evaluated data between 2003 and 2008, looked at the percentage of the population that met the targets recommended by the American Heart Association for 7 factors, and in fact, it was less than 1% of the population who were achieving all of the goals. The good news is that we've learned a lot about behavioral science, and the key is to apply the various principles of behavioral science when trying to get people to change behaviors. It's not a one-size-fits-all approach. For example, there's a model called the stages of change, or trans-theoretical model, where people are classified as being in different stages, such as pre-contemplation, not even thinking about making a change, contemplation, starting to think about it, preparation, where they're preparing, action, where they're making a change, and then maintenance. And one of the keys is to identify where along the stage of readiness to change individuals are, and then target the messages to them. And we should be trying to do that through mass media, through some of the newer technologies like social media, and then of course in the doctor's office, and then leveraging various incentives. Employers are starting to adopt that approach, and fortunately a number of the insurers also are.
Okay, thank you. I got a question from Nancy, who is listening to you tonight, and she wants to know, could a healthy lifestyle also improve and benefit those that have heart murmurs or heart rhythm issues?
Right, and again, that's a very good question. The answer is yes. Once the condition is under adequate control and has been adequately evaluated. So you want to make sure that you've received clearance from your physician, in particular, to participate in regular exercise. But once you've received clearance from your physician, undoubtedly leading a healthy lifestyle is of great importance for individuals who have valvular heart disease and individuals who have various heart rhythm disturbances. For such individuals, again, technology can be leveraged. There are various ways, and I see it's up on the screen, Apple Watch 6 and various other ways where a person can assess their heart rhythm, and that can be helpful, but undoubtedly leading a healthy lifestyle will be of benefit.
Thank you. I 100% agree with you. You touched on this about whether these, Apple devices, etc. There are many, many devices now, smart technology, where you can assess your rhythm. And I have found it very, very helpful because a lot of times people are having symptoms. They'll come to the cardiologist like myself with dizziness or any kind of cardiac symptom, shortness of breath, even chest pain. And a lot of the times we're trying to find out if they've got an underlying arrhythmia. So we use things like a Holter monitor or an event monitor, sometimes for 30 days. And we sometimes and often we do pick up whether there's a problem or not. We're always trying to find out, is there an association between the symptom like dizziness and an underlying irregular heart rhythm? These monitors can be very helpful because you can actually just press a button and get your rhythm right at the time you're having a symptom or at any time you want. And this is easily transmittable to a doctor's office. So I want to just emphasize what you said. You should be in conjunction with your primary physician, your cardiologist, your specialist, because these technologies are really helpful when your physician, your healthcare provider, or whoever it is seeing this information and seeing it immediately. So I'm sure that you 100% agree with this. It's best that you're using this information with and under the supervision of your doctor. Let me ask you this question.
100% correct. I agree with you.
You can weigh in on that. Many people are not familiar with smartphones and apps. I was actually blown away that there are 318,000 apps. Do you think it's important for family caregivers to learn this technology? Because a lot of people, especially elderly, and let's say a lot of people over 50 and 60, they're not really familiar with this technology that a 3-year-old can manage now, and sometimes younger. How important is it that we get to use this technology, and should you be trained? Are there places you can go? Every hospital system now has got apps. I know at NYU we got a fantastic app. There are companies like Medici who've got these ways that you can connect with your doctor, because when you can connect with your doctor and almost text your doctor whenever you want, which is starting to happen, it means you've got an immediate connection. And I think it's important, I'd like you to weigh in, that you try to find a way to work and use this technology to your benefit, which is exactly what you're saying tonight. The time will come where this is essential for your best health.
I personally believe it's extremely important for family and caregivers to learn how to use the technology so that it can be leveraged for elderly individuals and other individuals who may not be as tech savvy and may not be able to use the apps. There are a number of initiatives underway at the moment where there are individuals who serve as patient navigators specifically to help teach the family member or the caregiver how to work with the elderly individual, or to assist the elderly individual themselves in leveraging the app and the new technology. Over time, more and more older individuals are becoming familiar with the internet, with the use of the cell phone. So we expect the situation to improve significantly in the near future. But in the interim, extremely important. We're involved in many initiatives where participants are not tech savvy, and we work with their family and caregivers to leverage the various technologies. So Dr. Goodman, that's a great point that you make. Really important. And again, individuals should speak to their healthcare providers, or the health insurers, healthcare systems, and see if they can be of assistance when it comes to that.
So that's really important. You don't have to feel left out. There's all the systems, the healthcare systems are so happy to try to involve you and make it easier for you to navigate it. I got a question from Michael Moskowitz. I'm sure you've heard this question before. I've heard it many times. Dr. Gordon, what do you think of Dr. Caldwell Esselson's work and diet, the vegan diet, whole foods, no added salt, oil, sugar, basically about 10 to 15% fat content, this very plant-based diet, and there's studies, and I mean, I just want to comment that it's really hard to do that. But say you can do that and you really push for that. Do you really think it's better than the Mediterranean diet?
Yeah, I'm privileged to serve on the nutrition work group for the American College of Cardiology, and Dr. Esselson is a member of that. So through various communications, I've had the good fortune of interacting with him. He's conducted some great research documenting the benefits of such a diet, and there's no doubt that if you can comply with it, it's extremely beneficial. When implemented in an appropriate fashion, individuals are more likely to comply. So for anybody who's interested, I would recommend that. The good news, though, is that there are other diets that have also shown to be beneficial. In particular, there's a significant body of evidence documenting the benefits of a Mediterranean type diet, and a diet referred to as the DASH diet, which is the dietary approaches to stop hypertension. So those are other diets that are also beneficial and are really in accordance with the very brief guidelines that I provided. One of the other pioneers in this field was Dr. Dean Ornish. He still is a pioneer in this field, and his research has demonstrated the benefits of diets along the lines of Dr. Esselson.
Well said. I think we just need to point out that the Mediterranean diet has a huge amount of data, and if you can get to the Mediterranean diet and do that and comply with it, I think you're doing just fine, and it's a lot easier. But both these diets are clearly far superior to most of what's going on out there.
Right, and there was even a study published recently showing that Mediterranean diet with small amounts of lean meat is still extremely beneficial.
I'm going to leave you with this question, which is really important. I mean, we faced a terrible situation in the last year and almost a year and a half now. How do you weigh up in a nutshell in 2 minutes the impact of COVID-19 on our healthcare system in the United States? And of course, maybe there are some advantages. There's a lot of issues. How would you sum it up? What is the challenge for the future when it comes to our healthcare system based on what's happened?
As I mentioned, unfortunately, the COVID-19 pandemic has interacted with the chronic disease pandemic to create this perfect storm. And we've been faced with a terrible situation. I believe personally that we're going to be dealing with many of the adverse consequences for years to come. Unfortunately, during the pandemic, regular care, in particular preventive care, has been compromised in many cases. It was not viewed as being essential care when it should have been viewed as essential care. So individuals aren't up to date with their preventive test screenings and other vaccinations. It's made it more challenging for people to lead healthier lifestyles. And we'll be dealing with those consequences for years to come. There's still a lot that we don't know, such as some of the long-term consequences of COVID-19. On a positive note, as I mentioned, I think it has had a favorable impact on the acceptance of telehealth and the use of digital health technologies. Now, right at the moment, the pendulum may have swung too far to the one end. Before the virus hit, we were in a situation where telehealth wasn't well accepted. During the pandemic, the pendulum swung the other way. And really, we need a middle of the road approach in order to ensure that individuals receive optimal care, as I've heard you refer to in the past, Dr. Goodman, a hybrid type of approach. And that's where I believe we're headed to, where we can leverage the best of the traditional approaches that have been used for many years together with the newer technologies.
And on that note, Dr. Gordon, thank you for this terrific presentation. That was one of the best presentations we've had. You did an incredible job of summarizing why it's so important to be proactive, to work hard in terms of preventing heart attacks, strokes, and chronic illnesses. I just want to say, for those of you that would like to have the slides, we are going to put this lecture like we do on YouTube. You'll be able to go through it at your own pace. You saw a tremendous number of great resources there from Dr. Gordon, and you will be able to see this presentation, as are many of our presentations, on YouTube in about a week. I want to end off by thanking Anya, as always. Here's how you contact us, hearthealth@nyulangone.org. I look forward to seeing you all back, and please tell your friends about it. This is how people learn about prevention. We're doing osteoporosis update. Don't take your bones for granted on May 25th. And there is the email address to get more information. Once again, Dr. Gordon, thank you very, very much.
Thank you.
Terrific. I'm really grateful.
Thank you, and thank everybody for attending.